Hello, friend. Welcome back. Today's Friday. You have reached a new video of Frequently Asked Question Friday. That's a mouthful. Frequently Asked Question Friday, where I go through the most frequently asked questions about Medicare. I've got 3 today. Make sure you look in the show notes if you'd like to skip ahead, be my guest. If you have all the answers to these 3 questions, stop watching the video. But if you look at the show notes and say, hey, that's a great question, I don't really know the answer, then keep watching. Okay, so if you are new here, there is a free Medicare 101 webinar that's available to you in the description below. Click on that and you'll see when the next one is. There's also a Medicare breakdown book that I have written. If you are the person who likes to turn the pages, the actual physical pages, and take notes, maybe even write in it, highlight in it, that's the book for you to learn Medicare. So, the first question is, let's get into it. Will I automatically be enrolled in Medicare when I turn 65? And I'll go ahead and share my screen. Again, will I automatically be enrolled in Medicare when I turn 65? And all these answers are like, it depends. And so for this one, it is as well. If you are receiving Social Security or your railroad retirement, or disability benefits after 24 months. For disability after 24 months, you will automatically be enrolled in Medicare Part A and Part B. So that red, white, and blue card is going to appear in your mailbox 3 months before your birthday month. So this means if you are not taking your Social Security income, you're still working, you're that person that asks me all the time, Alyssa, I'm going to continue to work. I'm going to delay Medicare. Or Alyssa, I'm going to continue to work, so I'm not going to enroll in Medicare. Well, just remember that Medicare has actually nothing to do with Social Security. It only has to do with Social Security when we talk about billing purposes. So please don't be that person that thinks that, well, I'm not going to start my Social Security. I'm going to keep working. Therefore, I must delay Medicare. That is inaccurate. So let's go back. Will I automatically be enrolled in Medicare when I turn 65? Well, let me ask you a follow up question. Are you currently taking your Social Security income? If the answer is yes, then my answer to you about automatically being enrolled is yes. If your answer is no, then my answer to you is no. You will not be automatically enrolled in Medicare. Therefore, if you would like to enroll in Medicare, you need to go on ssa.gov, apply online, give them a call, go in person, whatever floats your boat, but you will need to sign up for Medicare manually in either of those methods. Okay, I think I answered that question. And by the way, if you have a question that you would like to be reviewed and answered on a video, drop it in the comments and I'll get to it. Next question. Does Medicare pay for dental services? Okay. Oops. There we go. Does Medicare pay for dental services? And the question is, or the answer is no. Medicare does not cover routine dental care or most dental procedures such as cleanings, fillings, tooth extractions, and it just got cut off. Dentures is in there. So when it comes to dental, there's 2 ways you go about it when you've got that red, white, and blue card in your hand. If you go the Medicare Advantage route, because you're technically giving up your original Medicare rights and you are saying, yes, United Healthcare, I'm contracting you to take care of me and giving me my hospital benefits, my medical benefits. And United Healthcare says, happy to do business with you. We're going to sweeten the deal and actually give you a plan that includes things that Medicare does not cover. So it's going to include dental, vision, hearing, over the counter credits, things like a lot of the preventative screenings are all going to be included in this plan. This is a Medicare Advantage plan, aka a Part C, as in cat plan, as in comprehensive. Think about that. Think about Medicare Advantage is the most comprehensive plan. It includes everything. Now, is it the most comprehensive coverage? The jury's out on that one. Okay. So back to, does Medicare pay for my dental services? And you've got a red, white, and blue card, and you're saying, don't slap me with that Medicare Advantage nonsense. I get that all the time. It actually, the statistic is, everybody listen up, that half the nation is on a Medicare Advantage plan and the other half of the nation is on a Medicare supplement plan. I can give this same presentation to a room full of people and it's sliced right down the middle of the people who go into Medicare Advantage or Medicare supplement. So just listen. Does Medicare pay for my dental services? You've got a red, white, and blue card. You say, I've got a plan G, I've got a plan N, I've got a Med Sup, aka Medigap. How do I get my teeth covered? Your option is only a private plan. So a private plan, you pull it out. I love Aetna, Emeritus, Manhattan Life, great companies for dental coverage. And it's basic dental. It's nothing fancy. You probably have the same exact coverage if you're working in your own group insurance. So my kind of budget saving tip, if you are on a Medicare supplement plan and you're going to continue to work, keep your dental plan with your employer. You'll save some money while you're employed with them. Then when you get off or when you stop working and you're off your group plan, then you can purchase a dental plan. There is no kind of weird enrollment period, penalty, none of the red tape and caution tape like you get with the other parts of Medicare. It's actually not included in it because Medicare does not cover dental. So the same blurb for vision, same blurb for hearing. Next question. How do Medicare managed care plans work? So this is like a question saying, what the heck is a Medicare Advantage plan? So, Medicare managed care plans are another way to receive Medicare benefits. All plans must provide all the services that you would receive under original Medicare with some added benefits like the ones I just spoke of: the dental, the vision, the hearing, the over the counter credits, the free gym membership, the drug plans included in it, and in some of them and most of them. You usually must use the doctors, hospitals, and providers in the plan's network. Don't say I didn't tell you so. I love that we have advantage plans for the people that need the advantage plans, that they want a one-stop shop, that they understand that there's going to be some copays, some co-insurance, there's a max out of pocket. It's like there's a plan for everybody, different strokes for different folks. So if you are looking at a Medicare Advantage plan and you're like, heck yeah, sign me up for that $0 plan. I'll save me some insurance premiums. Perfect. But know that you want to look at yourself, okay, in a Medicare managed care plan, in an Advantage plan, aka Part C, in a really good year, what are my out of pocket costs? But let's just say I get heart attack, stroke, cancer, or I get put in the hospital, or all four happen. Like I need my head transplanted and all my limbs transplanted. What am I actually looking at for medical costs? I have the worst year ever. what am I looking at in medical cost? The answer is the max out of pocket. So if you're a person that unfortunately gets cancer, most managed care plans have 20% coinsurance on cancer, on chemotherapy. You will pay 20% of that chemo treatment up to the max out of pocket, which is five, six, seven, some plans $9,000 out of pocket. Not 9,000. It's like 8750, 8550. It's close to 9,000. So what that means is take the free plan if you want the free plan. Take all the bells and whistles if you want it, but be sensible about it. What do I mean by that is agents like myself, we usually are able to write you a hospital indemnity plan, a cancer plan, a heart attack and stroke plan. Think about it. If you have heart attack, stroke, you'll end up in the hospital. If you get in a car wreck, you'll end up in the hospital. A hospital indemnity plan will help you with the copay on this managed care plan. What does that look like? It's some plans are like $350 a day for the first 6 days and then $0 after that. That's what a managed care plan looks like in the Medicare world. So my question always is what kind of financial problem can you handle on this managed care plan? And if you can't handle a one, two, three, four, $9,000 problem in 1 year, I would recommend looking into an indemnity plan that pays you upon indemnity to the hospital. Same thing with cancer. The thing about cancer, and in most cases, I recommend a cancer plan over an indemnity plan because it's such a long treatment. Sometimes your cancer treatment will bleed over into the next year, which means you will need to hit that max out of pocket again before the health insurance company takes over. Not to mention, I live here in San Antonio. Some people want to go to MD Anderson in Houston. There's travel costs, there's hotel costs, there's food costs. Um, People are still working, so maybe there's a loss of income. These plans help take the sting out of the entire situation. The drugs, the prescriptions that you get prescribed when you have chemo. I have only heard, not speaking from experience, the anti-nausea pills that they prescribe, the stomach pills that they prescribe to help you with take the chemo. Those are really high tiered, so your out of pocket costs will sometimes rise when you run into that scenario. So again, take the $0 plan. That's fine if that's the way you want to go. However, know that there's some options to keep in your back pocket that say, okay, in the event of the highest paying copays on my plan, I've got a backup plan. So a managed care plan is just like what you're currently on, probably. If you're still working, you got a PPO plan, that's a managed care plan. There's a deductible, there's a copay, there's a max out of pocket, there's a network. If you want to get yourself out of a managed care situation, you go with a Medicare supplement. If you want to save a little bit in premiums, but know that it's a pay as you go plan, and that in a really bad year, you can hit your max out of pocket, but you understand that risk, go with a Medicare Advantage plan. It's not that hard. A lot of people will have some kind of medical issue going on at the same time that immediately it's a no-brainer. But for those of you who, and most of people turning 65 just getting on Medicare, um, they're usually pretty healthy. It's not until 4 years later where they say, oh shoot, this happened. In which, if you're in a Medicare Advantage plan, you deal with the copays. If you're in a Medicare supplement plan, most of the times I'm hearing, thank God I picked that Medicare supplement or the Medicare supplement plan, because I've had some extreme treatment and I haven't had to pay anything because I hit my deductible and my Medicare supplement plan picked up whatever Medicare did not. That's usually the stories I hear. But 3 questions is all. This video is already too long. Stay tuned for the next Friday, frequently asked questions. Maybe I'll rename it because I don't know if I can take too much of that. What's your question? Drop it in the comments below and I'll hit it up in the next time. The more I get, the more I can talk about. And I love bringing this free information to you. So stay tuned for the next video. Give it a like, comment, or give it a subscribe if you feel like it. And we'll see you in the next video. Bye bye.